It's something we'll all likely face as we get older, is taking prescription medicines to improve our quality of life. And we'd expect our caregivers to know what we're supposed to be taking and when.
Yeah, but 7 News I-Team senior investigative reporter Lisa Fletcher discovered medication dispensing errors, and more common than you think, and nearly cost a D.C. woman her life.
When 74-year-old Rosina Jackson went to a rehab facility to recover from a blood clot, she thought the worst was behind her. Little did she know that within weeks, she'd be in an intensive care unit with a life-threatening condition caused by a mistake at Capital City Rehab and Healthcare in Southeast D.C.
They gave her someone else's medication.
And nobody noticed?
Nobody noticed.
How long did this go on for?
We don't know.
Daughter Marquette Craig says it wasn't until her mom complained about swelling in her throat that the family examined what the rehab facility had given her.
The medicine that they had sent her home with that belonged to someone else was stuck down in the middle of these.
Eldest daughter Mildred discovered the medicine her mom was taking with someone else's name on it was the blood pressure drug lisinopril, to which her mother is severely allergic. Her throat nearly swelled shut. To survive, doctors put Rosima on a ventilator and into a medically induced coma for more than a week. Medication errors are not rare. A 2022 report estimates 7,000 to 9,000 people a year die from the mistakes, and hundreds of thousands more suffer adverse reactions.
How likely is it that the number of medication errors is underreported?
Very likely. The extent of the medication errors that are reported to any agencies are probably much lower than the actual errors. So I think we're seeing the tip of the iceberg when we look at error reporting.
Rita Jew is the president of the Institute for Safe Medication Practices.
There is so many different systems that failed in order to lead to that medication errors.
Marquette says when the family told the facility that Rosima was in a coma after being given someone else's medication, she got this letter apologizing for the inconvenience and says she was badgered to give the medication back.
Can I go with you to go get it? I'll drive behind you and go in the house. You go in the house and get it and bring it to me. I said, no, I'll bring it back to you.
Why do you think they wanted it back so bad?
They want the evidence to go away, that they gave wrong medicine to her.
The 7 News I-Team pulled Centers for Medicare and Medicaid Services records on Capital City, formerly Transitions Healthcare, and found that this isn't the first time the facility made medication errors. According to inspection reports from 2020 and 2021, twice the facility's pharmacist failed to identify a medication error. On several occasions, staff failed to administer meds prescribed by doctors, including not giving a patient physician-ordered drugs for 19 days. When Marquette went looking for answers, she says she got blame.
One of the nurses said, oh, your mom should have read her medicine. That's her job, to read her medicine. Y'all didn't read it? Exact words.
Oh, that's totally inappropriate.
Mark Miller is the D.C. Ombudsman for long-term care facilities. He says errors like these are inexcusable.
The obligation is on the facility to make sure that, you are getting the right medication as prescribed for you. Give me somebody else's medicine, that could kill me.
We made multiple attempts to talk with Capital City Rehab's administrator, all of which went unanswered. Marquette Craig says she wants to make sure the facility answers to someone.
I think their license need to be taken. I don't think they need to have anyone else in a nursing home anymore. I think it need to be shut down.
Ombudsman Mark Miller says he's looking into this and will be in touch with the D.C. Health Department, which has the power to open a broad investigation.
You can't understand how this could happen, but bigger than that, how is Ms. Jackson doing?
She's doing better. She's home, and her daughter tells me that she's improving. Her daughter also tells me that her medical bills are right now around $100,000.
Wow.
And get this, annually, the cost of taking care of people who have medication errors is $40 billion. and it impacts about 7 million people a year.
And it's outrageous they tried to turn it around and blame her for not reading her medication. Their job is to give her the proper medication.
That is what the Ombudsman said, and that's certainly what the family believes. Now, I have posted a whole separate discussion with the Ombudsman, Mark Miller, on WJLA.com. He offers you guidance on selecting a facility, what questions to ask, and some important things to look for. Plus, we've got resources and phone numbers there for you as well.
D.C. Department of Health has now launched an investigation into a district rehab facility.
It comes in the wake of a 7 News investigation that exposed a near-deadly medication error. Senior investigative reporter Lisa Fletcher has new revelations from the family.
Rosina Jackson's family trusted the Capital City Rehab Nursing Home to give their mother the right drugs.
They gave her somebody else's medicine.
Doctors had to put the 74-year-old into a medically induced coma for more than a week to help her survive. When the 7 News I-Team first reported this story, the family showed us this letter from the director of Capital City Rehab, apologizing for the, quote, inconvenience that nearly killed Rosina. We did some checking and found federal inspection reports that showed this wasn't the first time the facility had made medication mistakes. We took the case to D.C.'s long-term care ombudsman, Mark Miller.
You give me somebody else's medicine, that could kill me. If they had followed their protocol, you know, what medication am I giving it to the right resident in the right room? You know, it's not rocket science.
Miller did some checking, and according to him, it turns out more than a month after the error occurred, Capital City Rehab still had not reported the mistake to the D.C. Department of Health.
Should that error have been reported by now if this happened in mid-December?
Oh, definitely. It should have been reported immediately.
D.C. law requires incidents that result in harm be reported within 8 hours. And according to Miller, the facility's administrator told a member of the ombudsman staff that he had no knowledge of the circumstances that led to Rosina Jackson being hospitalized. A shocking revelation to her daughter, Marquette Craig, who says he'd known about the grave situation from the time her mother was hospitalized.
He absolutely lied. He knows exactly what's going on. I told him she was in a coma. I told him everything that was going on with my mother, myself. And I showed them a picture of my mom, say, this is how my mom looked.
What picture did you show him?
The one with her laying in that bed with the tube down her throat. I showed it to him.
So how does it make you feel, Marquette, when you find out that he's saying he had no idea about any of this?
He don't care about nothing. He don't care nothing but his paycheck.
We spoke with a representative for Capital City Rehab who told us they can't talk about the case. They did follow up with an email that said while ownership was not aware of the incident, they are now and want staff to live up to the high standards they've set.
D.C.'s Health Regulation and Licensing Administration tells us they can't speak to us about the investigation until it's closed. We will bring you their findings as soon as they're available. You can see Capital City Rehab's full statement and our original investigation on WJLA.com.
After the 7 News I-Team uncovered problems at a D.C. nursing home so serious, one resident nearly died.
Yeah, senior investigative reporter Lisa Fletcher with what health investigators found and why concerns don't end with this one facility.
In a race against time, Marquette Craig rushed her elderly mother, Rosina, to the hospital as Rosina's throat swelled shut.
How close was your mother to death?
At a blink of an eye.
Employees at D.C.'s Capital City Nursing and Rehabilitation had given Rosina someone else's medication, one to which she is highly allergic.
We didn't know what to do. We were out of our mind going crazy because we was like, this shouldn't happen. The nursing home should never have done this to her.
Rosina was placed into a medically induced coma, spent 8 days in the ICU, and more than a month in the hospital. D.C. Health opened an investigation into the nursing home in the wake of the 7 News I-Team exposing problems at the facility.
Now, more than 3 months later, D.C. Health has released this 208-page report, documenting far more than the problems we uncovered with Rosina Jackson.
There were 31 separate citations. It's about 5 times higher than what the national average is for deficiencies.
Mark Miller is the long-term care ombudsman for D.C. He says most concerning were 5 violations that represented immediate jeopardy or harm to residents, 3 of which were medication administration errors, similar to what we previously investigated.
They involved giving people the wrong medication, giving people expired medication, in one case expired insulin, and not providing people appropriate information upon discharge about what their medications were. And so those are very serious.
Miller says the complaints and problems aren't new.
If you go onto the Federal Nursing Home Compare website, there is a red hand in front of the facility's name, which means they've had previous citations for abuse and neglect cases.
That's in D.C. We found the facility's owner, Jacob Carmel, owns at least 5 facilities in 3 states. Centers for Medicaid and Medicare Services has that red hand warning for abuse and neglect on 3 of Carmel's nursing homes. Since mid-2020, there have been nearly 300 violations among the facilities. Additionally, federal reports show just this year, Capital City Rehab was fined more than $250,000, and one of his nursing homes in Florida more than $139,000 for violations. We repeatedly called the number our research shows as Carmel's phone, and were hung up on.
3 hang-ups.
We wanted to ask about problems at the facilities that are home to nearly 1,400 vulnerable individuals. Miller says this is why he's pushing for accountability across the industry.
The spotlight is being shown on them. They don't necessarily like the transparency because unfortunately some of these are viewed as their investments. But you're talking about real people for whom this is their home.
Real people who Marquette Craig says, like her mom, deserve better.
I want them to be held accountable for every person that they changed their family lives. They changed ours dramatically. Ours was changed real bad.
Capital City's then director has been replaced, and DC Health put the facility on what's called a restricted license, which limits capacity and for months prevented them from taking new residents. A spokesperson for the facility sent us this statement. Our community is in substantial compliance with all regulations, and we are committed to deficiency-free, resident-centered, high-quality care.
It is just so scary.
Yeah, excellent reporting, Lisa. But in that statement, they said substantial compliance. Exactly what does that mean?
It means that they can participate in Medicaid and Medicare programs. But as far as DC is concerned, the license still has not been fully restored.
And families feel helpless when this is going on. There's not much you can do, except reach out to somebody for some help.
They do, and there's the potential here for fines. The DC Health cannot discuss with us specifically what they are, but they could be fined for the most serious violations up to $22,000 per day or per violation. So it remains to be seen what will happen on that front.
And you hope that would cause some change for the better. Lisa,
for
thanks.
all the residents.
Thanks very much.
Lisa.
Yeah.